had this policy ready from April, but because of the everybody's so busy, and then it was starting to get to summer, I said let's do it now. Okay, I push it back to now. So what we're going to go through is the overview is the purpose why we're having this, the definitions, some practices, cold stress practices and procedures and control, and the responsibilities. The purpose of this is to provide guidance, okay, for work safely in cold weather conditions, addressing health and safety concerns that relates to cold weather. Okay. So I'm going to be going back and forth from this to the HR downloads training, which gives the definitions. Let's see. So it's going to go through a whole bunch of definitions. What is cold stress? What is hypothermia? Frostbite? So forth.
Cold stress is the response of the body to cold temperatures due to heat loss.
Can you
If
hear?
exposure to cold conditions is prolonged or severe, a person's ability to recover is greatly threatened. The body can lose heat in several ways. We start to feel cold when there's a drastic difference between the air temperature and our own body temperature. The human body is healthiest when its internal core temperature stays constant at 37 degrees Celsius. Since we are most comfortable when the external temperature is between 18 and 22 degrees Celsius, temperatures below that can cause distress. This type of heat loss is called radiation. Heat loss can also occur by conduction. That's when we lose heat by touching something very cold. The best example of this is exposure to cold water. Convection is another process that increases the chance of heat loss. We can lose heat from our bodies when we're exposed to an air current. The degree of loss depends on air speed, so on an especially windy day, expect to lose a lot more heat. Anyone who dresses with too little clothing in cool weather is at risk, but there are those who may be predisposed to injury due to other factors. These may include those who suffer from certain medical conditions such as diabetes, peripheral neuropathy, and diseases affecting the blood vessels, people who take medications like beta blockers, and people who don't get enough exercise, smoke, or consume alcohol. Some additional factors that contribute to cold stress or make a person more susceptible to suffering from it are low air temperature, humidity, strong air movement or conduction, age, mainly 45 years and older, level of physical exertion, degree of acclimatization, which we will cover shortly, metabolism, poor level of physical fitness or health, alcohol consumption, and medications or medical conditions. You should try to avoid cigarettes, coffee, and other drinks with caffeine because they decrease circulation. Alcohol should be avoided as well because it increases the rate at which your body cools. It's a good idea to do everything you can to keep dry too. Wet skin or wet clothing can lead to big problems. Water conducts heat away from the body 25 times faster than dry air. Wind chill is another factor that greatly influences how cold a person feels when working outdoors. Generally speaking, you tend to feel colder as the wind speed increases. The wind speed, when combined with the effect of the cold air temperature, is known as equivalent chill temperature, ECT, or simply wind chill temperature in degrees Celsius or Fahrenheit. The wind chill measurement is a useful tool for assessing the possible health effects of the cold and deciding what clothing requirements are needed. Asthma. Several health problems and disorders can result when workers are poorly prepared for cold conditions or are exposed for extended intervals of time. We can separate these disorders into three categories: non-freezing, freezing, is a mild cold injury.
I won't go through that
Frost nip is the mildest form of a freezing cold injury and is evident when the top layers of skin freeze. When earlobes, noses, cheeks, fingers, or toes are exposed to the cold, the top layers of skin will harden and freeze. The affected area turns white and sometimes may feel numb. If your tissue temperature falls below freezing, or when blood flow is obstructed due to cold conditions, frostbite will result. The blood vessels can be severely damaged, in some cases permanently, and in addition, blood circulation could stop altogether. In milder cases of frostbite, often the extent of the injury will be limited to some redness and swelling and slight pain. In more severe cases, tissue damage will occur without pain, and there's also the possibility that blistering and gangrene can develop. If exposure to cold conditions continues long enough, eventually your body will begin to shut down. It's no longer able to generate adequate heat to compensate for its loss. Your core body temperature will start to fall. You'll feel pain in the exposed areas of your body, and soon that pain will diminish and change to numbness. This is called hypothermia. If workers are experiencing hypothermia, they will begin to lose clarity in their thinking. They will get drowsy and start to feel muscle weakness. When the shivering stops, this is a very bad sign. It means the core temperature is reached below 33 degrees Celsius. If it drops further to 27 degrees Celsius, that's when coma sets in. It is critical that workers recognize the early warning signs of cold stress. It is important to be attentive when working in cold environments and watch for symptoms in yourself and your coworkers. Some early warning signs may include physical discomfort, feeling cold, constant shivering, loss of feeling and dexterity in fingers, hands, and toes, blue lips, frost nip when the outermost layers of skin turn white, reduced mental alertness or poor decision-making, and confusion or odd behavior. Did you know that if a worker stops shivering, they could be headed for disaster? Don't assume it's a good sign and that they are warming up. If shivering stops, it could mean the person has become hypothermic. As cold stress worsens, symptoms may include extreme discomfort, extreme shivering initially, then shivering stops, severe hypothermia, frostbite, loss of consciousness, and the heart stops. Now that we have covered symptoms that a person may exhibit when in danger of experiencing a cold stress disorder, we will look at recommended treatments. First aid treatments for cold-related injuries such as trench foot or frostbite include seeking medical help, moving the victim to a warm area, loosening tight clothing or jewelry that might be hindering circulation, covering the affected area with a sterile dressing, and putting some gauze between fingers and toes to absorb moisture and keep them from sticking together. Treatment for frostbite that should not be administered includes: do not attempt to rewarm the affected area on site, but do try to keep it from getting colder. Do not rub the area or apply dry heat. Do not permit the victim to drink alcohol or smoke, and do not rub the area with water, snow, or ice. For victims that are showing signs of hypothermia, immediate treatment is critical. Hypothermia is very serious and may result in death. Treatment includes: seek medical help immediately, it's an emergency. Remove wet clothing. Place the victim between blankets. Cover the person's head. Use body-to-body contact to rewarm victim if needed. Unless the victim is unconscious, offer warm, sweet drinks. Perform CPR if victim stops breathing. Do not use hot water bottles or electric blankets to warm a victim. They can heat a person up too quickly. Don't rub a victim's skin vigorously in order to generate warmth. Take care, as the skin is fragile from the cold exposure. And don't offer hypothermia victims any alcoholic beverages. Next, we will cover how occupational legislation regarding cold exposure in the workplace helps to protect workers in Canada. For
Okay, so we're not
occupational
gonna
health
go
and
through
safety
that
laws
one.
regarding
So I know you guys don't work outside all the time, right?
Who doesn't work
Not all
outside?
the time, but we still work.
During the
outside.
winter times, it's occasionally.
So, some days you'll work all day outside though.
Some days, okay.
Yeah.
So that information was important for you? You find that
Which one?
important? The definitions and everything that we
With the
went through.
legislation, the laws and stuff like that.
Well, the definitions that we went through, that
Oh.
just went through.
Oh.
What you're supposed to do,
Yeah.
give somebody has
Yeah.
frostbite or so. Okay. Okay, so I know you guys brought some concerns to me when we spoke about cold stress and what concerns you guys have in terms of like when you're working outside and so forth. So we put that into consideration and that's what we're gonna go through. Okay, so I know you guys said that when you guys go to residents' homes, sometimes they don't clear their snows, right? The doors have the snow there and so forth. So what we came up with is some
Give you guys a
scheduling
shovel.
controls, huh?
Give you guys a shovel.
Some scheduling controls. So the plan is to try to schedule, and we're gonna go through this with Ryan and Melanie. Try to schedule, limit the exposure when it's cold weather for outside. So we're gonna work with that and see how that goes. Update the ERP during winter months in sending, so you know how we send reminders to the customers to let them know that you guys are on your way? They're gonna update it during winter times to say they need to clear, sending out reminder emails to property managers and or residents to clear the snow prior to technicians' arrival. So we put these things in place, let us know if it's working or not, okay? Where feasible, perform partial components of task, indoor shelter, increase task variation and rotation, okay? So that are some scheduling controls, and then we're gonna go through that, as I said, with scheduling. So there's also administrative controls that you guys could do, which includes the buddy system and warm-up breaks. So for the buddy system, a buddy system approach allows for earlier recognition of risk of signs and symptoms such as frostbites to the ear, cheeks, and nose. So just be your brother's keeper. Warmer breaks when necessary. Do those, right? I'm not sure. Like, not all of you are gonna have your trucks close by, but whenever you do, try to take turns and do some warm-up breaks. Okay? Whether it's a few minutes, you get warm, turn on the truck, go back in, where possible. Okay? If you're indoors, then hopefully they do have it's warm inside.
Keisha,
Mhm.
isn't that a waste of gas?
That's what I was just thinking.
It is, but this
No,
is
but we
part
get
of it.
told all the time, don't run your truck.
Yo, you don't need a lot of warm our trucks outside.
Yeah, in the morning.
You guys, these are things that we're putting in place, right? These are things that we're putting in place, and this is what we're gonna be doing.
Sure.
Warm up
Okay.
engine, right?
Sorry?
Warm up engine sometimes early morning, we need it. Like
Yeah, you have to warm up the truck before.
Not allowed.
10 minutes something.
What's that? You don't need 10 minutes to warm up a truck.
Huh?
Why do you need 10 minutes to warm up a truck?
Right on cue.
It warms up quicker than sitting there idling.
Yeah, but what we're putting in place now, if you guys need to, when necessary, take warm up breaks, that's what you guys have to do, right? That's what we put in place.
Yeah, it's like, I remember years ago I was I was doing I think I was maybe with Mel. We were on Bay Street doing skylight, or not skylight, the canopy. And the wind was coming down there, and it was so cold. It was like -28, and then not including the wind. And it was like, you literally could work 15 minutes, and then you had to just step inside the vestibule for a few minutes just to get just a thaw. Then you could go back out. Otherwise, you're gonna get frostbite. Yeah, and everyone knows what frostbite looks like.
Yeah, we just went through that,
Okay.
okay?
Yeah, it's real.
So interrupt cold stress exposure once you feel like you are exposed to cold stress, once you're feeling discomfort or seeing initial symptoms of cold stress related injuries, right? Report to your direct manager if you're feeling this, right? So you have to self-monitor and also watch for your coworker.
it's just like the heat stress, you know, we gotta look out for each other, so it's like, if someone's starting to look like they're gonna pass out from heat, you know, like, you gotta make, they might not be aware of it, cause they're starting to get, for lack of a better word, like foggy in the head. It's the same like cold stress, you know, you don't realize, maybe you're like shivering and shaking, but you see the person beside you and they're not looking to say something.
Yeah. So, in terms of personal protection, you guys know it's winter, right? So you guys, employees should pay attention to protecting feet, hands, face, and your head. So we provide, wear layers and insulated footwear during winter months to protect yourself from cold and dampness. We provide like your uniforms, which is the winter jackets, the vests, the pants, hoodies, the toques, long sleeve shirts, and glove liners, right? So whenever you need this, just come see me. And I just gave you guys some stuff too, but whenever you guys need it.
Do we also have remember we used to have the insulated?
Little hand warmers or
No,
whatever?
the insulated gloves, remember they were,
Before-
Hand warmers.
Glove liners.
no, not the liners. They were
Hot pockets?
they were the bigger glove that was orange with the bright blue. I don't know if they had a cut rating though, but we used to have them. I found them hard to bend because they were so stiff, but they were warm, but I don't know if the cut rating was.
Yeah, it's probably, maybe that's why, because since I've been here, I haven't seen those.
Yeah, we had to get rid of a few gloves because they didn't pass cut ratings.
Not good to walk, eh? The lean one, not good to walk, too thick.
Yeah.
Some of them are,
Yeah.
some of
Well,
them.
best ones are the blue ones, just look at those ones, will do. Just joking. I know you're videotaping.
So just here where we're taping, so there, if you wanna come closer, so,
Hey.
over here. Okay, so moving along, working in icy, conditions. Slips, trips, and falls. I know that this was a concern for everyone. So we're gonna be maintaining supplies including salt and sand for use, both on-site and off-site. As you guys are aware, there's salt and sand at each entrance, right? So the employee entrance and the employee entrance here for the office staff, and at your entrance at the side. Okay? So it's been approved that we are providing you guys with salt for those who requested this. However, I bought 8. So if you need it, just come see me. Do not get rid of the containers because it's useful. Like,
Yeah,
it's
it's good
the-
to refill.
exactly. So don't throw this out.
Those are also not a make-work project. Do not dump it all in front of their aluminum front entrance so that it eats it away.
So but they're supposed to be cleaning and before you head there. So hopefully this is done, but this is provided for you just in case you need it.
Yeah.
That stuff's pet safe?
Yeah, it's what?
Is that
It's,
stuff pet safe? Like, cause if we go to somewhere with a pet, we're gonna have to tell them not let their pet out if it's not pet safe.
I'm not sure, I would have to look into this.
Most of the
There's
stuff,
warning signs here.
Most of the
Usually when
stuff
it's
where
blue,
you're
it's
gonna
pet
need it.
safe, but
most of the stuff where you're gonna need it though, you're not gonna be in someone's suite using it. It's going to
balcony
be,
It's
railing
gonna be
though.
the balcony.
it might be on the balcony.
Yeah.
Uh,
Well, hopefully you don't have to use,
Yeah,
Your
hopefully,
own.
that's
Hopefully they're not letting their dogs
Pee on the.
pee on the balcony.
That's like 80% of condo owners though.
Let alone.
They got the little poop patches now. The
If you
little
go there and
patches of
it's all
grass.
icy, but it's not water.
yeah.
okay, so we're gonna ensure that staff is wearing appropriate clothing, but you guys need to be accountable, right? You guys know that it's cold, you guys need to wear your thermals and all that stuff. Ensuring that our parking lot is clear, that's what we're gonna be doing. And the best of our ability, if you see that, say the salt, like, is depleting, let us know so that we could fill up. But usually we are on top of it, right, Chris? Yeah?
Yeah, and there's gonna be mornings where we're gonna have the snow, it's gonna be dumping on us. It's, you know, jump in, grab a shovel, we have lots of shovels, and give us a hand. Chris tries to get in early those days, get the parking lot cleared so that we can get you guys able to park and get the trucks out. But it's it's just one of those things that the front entrances and whatnot, they need to be cleared too, and the cat doesn't get in there. So we got shovels, we'll just push it all out of the way and get everybody going.
A lot of times, don't park in the back until,
Yeah, well, I'm gonna go through that procedure, yeah.
you wanna get the trucks out and then plow and then bring your cars back in.
So ensure that the pedestrian walkways are cleared on a regular basis, and ensure that, when you're doing this, it's done safely. Alright. So, we're gonna go through the procedures for the snow cleanup once you're here at work. So, when driving to work, right, staff is required not to park in the parking lot. We're asking that everybody, park either on the road, or I know I'm not encouraging anybody to go to any other company and park there. However, when you're in that early, sometimes there's nobody on that side. Okay?
And just make sure you, as long as you're not leaving your vehicle there all day.
Yes, you're not leaving it all day. All you're doing is when you're initially coming and we have a dump of snow, we're asking you guys to park on the road, don't park in the back. Okay?
Or
Reason-
or if there's nobody there, because they get here later than we do.
Yeah, 9
So-
o'clock.
Yeah, so we'll be clear
Long
and have your
gone.
cars parked, have you guys be moved back before they even get in. So
Okay?
it's not a big deal, but we don't want to be having you guys take off and forgetting to move your car back, because then it becomes a big deal. So
So snow will be cleared. So while you're parked there, Chris is gonna be clearing the snow at the front parking lot first. Following, right? Right. Following, doing the lanes after. And then, which technicians are able to move the trucks into the lanes, right? So you're clearing the front, clearing the sides,
And then get your truck out so I can.
get
go
your
back,
truck out so that he can do the back.
And then you can park.
Yeah, so you could park along the sides or the front, right?
Basically getting all the trucks out.
Yeah. So technicians are required to assist where possible with the snow clearing, as you mentioned before. Once the back parking lot is cleared, then that's when you're able to go back to your cars, before you leave here, go park in the back, so that we're not parking on the road, right? And then we could head out.
the reason why we do the back last is because if we did it while the trucks were there, we're gonna either A, hit the truck, or B, snow the truck in so that we can't get it out. So this way, we get the trucks out, then we can clear the back up, and then everybody's.
Wouldn't the lane be the best to get done first? That way trucks can slowly load one by one in the morning, and then
Chris clears the front so that if there is a problem with there's only a limited number of spots over there, right?
yeah.
And if it's a big dumping, we're gonna have other people starting to show up. So all of a sudden it's gonna start to become a congestion problem. That, and also just being able to move the snow around, like whereas a lot of it pushes across the street. We gotta start
Yeah.
making our piles, so.
Alright, anybody have any questions? Okay, now we're gonna move on to responsibilities. So, of course, the employer, is required to take every reasonable, measures to protect the worker. Providing the cold weather policy, providing education and training, and, which he approved this all for the trucks that was requested, okay? And you guys have your, uniforms, that's provided. So, for managers, they're gonna liaise with me, into ensuring that, the work procedures have been established, and, managers are to advise workers to report to them, right, when you're experiencing these cold stresses. Adhere to the recommendations of the warm work breaks, right? And establish to prevent frostbite or hypothermia, and reinforce the PPEs, right? So if they notice that you're not wearing something, a toque or glove liners or something like that, they're gonna reinforce this, alright? For HR and joint health and safety, Our responsibility is to provide assistance in developing safe work practices, provide assistance in the provision of information sessions, which we're doing, and prepare information related to cold stress. Address cold stress concerns with employees and make recommendations during the development to improve the safe procedures that are needed. Okay? And as employees, your responsibility is to be familiar with the policy that we put in place, wear appropriate clothing, follow the safe work procedures and to prevent cold stress injuries. Report to your manager whenever you're having these cold stress, and also to your co-workers. And take the warm-up breaks as necessary to prevent hypothermia and frostbite. And use the buddy system. Okay? You guys have any questions? Okay. And that's about it for the cold stress policy. Alright? I'm gonna hold you guys for a few more minutes. So if you've signed,